Hello and welcome. You're watching Medically Speaking, and I'm Meenakshi Upreti. With me, a very special guest, Dr. Anupama, the head of American Association of Physicians of Indian origin. Thank you, ma'am, for joining us on NewsX. Ma'am, first of all, talking about children and coronavirus, far as Omicron is concerned, the silver lining here in India has been that one, number of cases are reducing. Second, we've not seen a large number of children landing up in hospitals. But what do we know really about long COVID in children? Because that's really an unanswered question to which many experts still don't really have the key, don't really have the answer to.
Thank you, Meenakshi, for giving this opportunity to talk to the media. Children and COVID agree that more children have been infected this time with the Omicron. And because Omicron, as we know, this variant crosses, invades the immunity, even though we are vaccinated. So currently, the vaccinations are given for ages 5 and above in United States, but in India still it's not yet, right? So, but US we have been giving vaccines 5 and 8 years above, and so in spite of that, the infection rate is very high, and late in February in US is planning to vaccinate 2 to 5 years old kids also. So I think that will be the best for the children to be safe side, because now the infection rate is higher in children who are 5 and below, and 5 and above are doing better now because of the vaccination. So I think vaccination is helping.
Yes. So would you back the argument when we say that children should be vaccinated? Where do you stand on vaccination of children? Because here in India, we only have 15 plus who are vaccinated. When do you think is the right age from when a child should be vaccinated? Would you also suggest that India also starts thinking of vaccinating toddlers and above?
Yes, yeah, that's true. I think India also should start vaccinating children 2 years and above, because it's found safer that 2-year-old kids can get the vaccine safely. So there are very, very minimal side effects. They have not seen any fatalities because of the vaccine. So they found it is very safe in children. So we are starting from 2 years and above pretty soon, end of this month. So I think based on these studies, research, and protocols, they've been doing this research in that age group probably before they get into real, giving to the people, right? So I think this is an example that entire world can take it actually. When US is doing from 2 years and above, I think there's no hesitation why other countries should not start vaccinating their children from 2 years and above. This research data is enough for the entire world to follow.
And you say the research data is enough for the entire world to follow. But as far as the vaccine is concerned, which vaccine would you suggest should be administered to children? Because in India, you'd know the only vaccine, the only option as of now for teenagers seems to be Covaxin.
Right. So these are all RNA vaccines. So I think they are all safer. They all have similar, comparatively, they are all similar. In US, we have two different kinds of vaccine, mostly given Pfizer and Moderna, and they also have other vaccines also, but commonly given are mostly are Pfizer and Moderna. And India has, as you said, Covax and Covishield and all, but still they are all similar vaccines. Even though it is a virus,
vaccine is better than no vaccine.
Yeah. But yeah, I think vaccine is best for all. It is proven in India also for those who are vaccinated versus unvaccinated. We have enough data that unvaccinated people are more prone for COVID. That's a gold line now. We cannot say that anyone can go against that.
Yes, and ma'am, one more question, since we're speaking of children and COVID. Far as children are concerned in America, especially in the US, we've seen a large number of children who have landed up in hospitals. What really has been the reason for the same? Whereas in India, also the worry is, if at all, even in the future, there is an increase in the number of children landing up in hospitals, because pediatric ICUs, pediatric care in India, especially in rural India, is still date in quite a dismal state.
Right. Yeah. So the reason for hospitalizations in children is mostly respiratory infections, and then they are going into multi-organ failure. So multi-organ is that's the most dreadful thing for children, and but very small percentage are having that issue. So mostly they are all kids who have immune deficiencies, and they have asthma, or they have any kind of lung diseases, and all those are the ones who are being hospitalized. But a healthy individuals who are admitted with multi-organ failure are very small percentage.
And ma'am, one more question. Just tell us a little bit about the work which the American Association of Physicians of Indian Origin has been doing with the Indian government. And is there anything which you have done, especially at the height of the coronavirus pandemic?
Yeah, so API has done during the Delta wave, we have raised about $5 million for India, and we have supported several things so far. So let me give you, during the peak of the Delta wave pandemic, we sent some oxygen concentrators that was needed that hour, and ventilators were the other ones we sent, supported them with that. And after the COVID has gone down, so we still had funds, and we are using them for the poor charity hospitals in the rural areas where the access is very poor. So those are the hospitals we are supporting with the oxygen analyzers, biochemical analyzers. So these biochemical analyzers, they run the test like in an hour we can run 200 tests. So all the COVID tests and any test related to any organ system can be run very quickly and efficiently, so that when there is a high need, like a lot of patient, hospital is full of patients, so they can run the test very quickly and deliver the care very efficiently for ICU, especially for ICU patients. So those are the things we are doing right now. And also oxygen plants. So in the rural hospitals where they do charity, these are the non-profit hospitals. So we are helping them with the oxygen plant, so that when next wave comes, they will not have any issue having the oxygen issues. So whatever the need is, and ventilators, still we are getting requests to supply the ventilators and ICU equipment like monitors in the ICUs. So I think some of the hospitals during the peak COVID times, they converted to COVID hospitals. So they know now what they need, what they did not have during the COVID peak. So they are preparing themselves for anything bigger or any fatal variant which may come in future. None of us know what happens, what is our future. So it's preparedness is always there, and it's better.
Right, absolutely. And it's a very noble deed indeed, ma'am. And of course, as far as the shortage of oxygen concentrators, oxygen cylinders, ventilators is concerned, India did feel the pinch at the peak of Delta wave. But last question to you, ma'am, if I let you go. The Delta wave, people were scared it was deadly. In Omicron, it's a phenomenon seen worldwide. Many of us have been dismissing it as a mild variant. Many actually jubilating in the fact that they have at least once got Omicron, which means now they can go out and mingle. Do we know anything about Omicron's long-term effect? What do we know about long COVID? Something which we had discussed extensively in Delta, but now in Omicron, that seems to be in the back burner.
Right. Yeah. So I think something which we cannot take easy is the long-term effects of the COVID to somebody who was affected by the COVID. So cardiovascular effects, strokes, and these are the things we are noticing more in, and GI effects, like people are having GI symptoms like chronic gastritis and diarrhea and all these. So I think the COVID is particularly affecting mostly cardiovascular system and GI system. So I think we should not take it easy. And I think still we are not yet out of this danger, even though the cases are coming down. Like US, our cases have already dropped 50% now. But still what Dr. Fauci says is still we haven't come out of the pandemic, but we need to be cautious even though the cases are coming down.
Yeah, well, absolutely. We still haven't come out of the pandemic fully, and we need to be cautious. Cautious is the word, really, which is coming
Right.
from the American Association of Physicians of Indian Origin. Far as, of course, the people are concerned, the message today: wear your masks, get vaccinated. Don't, of course, panic. But caution is extremely important. Thank you, ma'am, for joining us.
Always.
And of course, all the help which you have spoken about, elaborated on, which you gave India at the peak of the Delta wave. Hopefully, this time, as many have been predicting, the pandemic becomes endemic and we just learn to live with COVID. For now, thank you for joining us on NewsX.
Thank you, Meenakshi. Thanks for the opportunity.
Thank you for your time, ma'am. Today it will be live 7 p.m. IST on NewsX.
Thank you. Yeah,
Thank you.
good.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.